Next, the second place winners for the $2,500 prize were Sickle Me Not, led by Dr. Joanne Hojsak, the Chief of the Division of Pediatric Critical Care Medicine and the founding director of the Pediatric Pain Team.
Hi, my name is Ed Berde. I'm with a company called Responsive Health, and some of you may or may not know Responsive Health is a spin-off from Mount Sinai, and we're working with the App Lab to bring some of the wonderful technology that they're building out into the real world so it could be used even outside of Sinai. So we attended the SINAIMedMaker challenge this weekend, and we came in with the idea of putting together a pain management tool for children, and then we met up with Dr. Hojsak when we heard that she was looking to do a more acute form of that, specifically for kids with sickle cell. And as most of you probably know, kids with sickle cell will live with pain their entire lives. So what we did was we came up with our format and really tailored it specifically for sickle cell anemia, and we actually had a small focus group of kids that came up with part of the design and even the name Sickle Me Not. So I'd like to introduce Dr. Hojsak, who's going to talk a little bit more about sickle cell anemia and just what it means to some of the kids that need to track this on a day-to-day basis. Thank you.
Hi. Okay, so I'm the director of the Pediatric Intensive Care Unit. I also run a pediatric pain team and take care of a lot of children with pain. And so I came to this MedMaker Challenge really to look for a group of people that would help work with children both on an outpatient and an inpatient basis to let them take control of their pain and to help them manage their pain and also to interact and communicate with their healthcare team. And so the challenges, again, that we focused on was pediatric sickle cell, and that these are a group of patients that live with pain throughout their lives and really need to learn how to manage with it and take control of their illness. When the pain is not controlled, it can lead to an increase in hospitalizations, and that increase in hospitalizations leads to numerous medical problems. And so keeping children's pain at bay and out of the hospital is a pretty good incentive. All right, again, these are just some of the numbers, but who we served with this app and with this whole idea were for children anywhere between the ages of 3 and 18 years of age. And it really is a communication tool to be used between the pediatric patients and their healthcare team. In addition, the patients can interact with their peers as well during it, so that if they're in the hospital, they can actually talk to another patient that's in the hospital with the same thing and kind of give each other a little bit of encouragement and get them through it. This can be generalized to any child with chronic pain on an outpatient basis, and it can easily be adapted for parents to be used with younger children as well as for the adult population.
Thank you. And these are the 5 goals that our product achieves. It's going to foster the relationship between patients and providers, and it works on multiple platforms, including wearables. It's designed to be user-friendly. We tested it with our target population. And there's also going to be a physician dashboard that the physician can get data analysis from, and it's going to integrate with the Health Cloud. And over the 48-hour period of the MedMaker Challenge, we achieved 4 real concrete milestones. The first of which is that we created SickleMeNot.com, which is a kid-friendly platform that we designed and tested with kids. We also created an iPhone app that can be used with kids or just a general population. We also achieved integration with the Health Cloud, and we also found a delivery mechanism with Prescription Universe. So if you could please just go to SickleMeNot.com. Thank you. This is SickleMeNot.com. I apologize for the sizing. Yeah, on the top left-hand corner here, you can see that there's these buttons, and it's designed to be a game that's interactive for children, so you can change the avatar. Unfortunately, it's not loading right now. You can also change the background. You can message your doctor, talk to other trusted kids, and you can also have a personalized login button. And then my colleague Rebecca is going to go through the specific functions of the app. Please switch back to the presentation. Thank you.
So over this 2-day period, we also created an iPhone application that had multiple features, the most important of which was that you can use a 3D model to pinpoint your pain and indicate how severe it feels on a scale from 0 to 10. You also have Icahns, which allow the child to say, today I can play with my friends, today I can do my homework, I can concentrate. There are also alerts where you can log symptoms that are more severe, such as fever or fatigue, that will send an alert to your physician. You can then engage in a HIPAA-compliant messaging system of the app. And lastly, you also have charts that allow you to monitor your progress as you go through treatment and continue to log your symptoms.
And this is what the physician sees on the health cloud and the EHR. This graph is just a simple graph of pain over time, and the data is from what the child inputs into the game. And this can be integrated with other medical data on the health cloud to create more complex analyses that will inform physician decision-making. It also integrates with other platforms such as wearables. And there is also a secure messaging function that allows the provider to communicate with the patient and the patient to communicate with the provider. And finally, we found a delivery mechanism for all of this, which is Prescription Universe, that came out of Mount Sinai's own app lab and is now spinning off into responsive health. And Prescription Universe is an easy way to deliver any sort of application. It's basically the Amazon for digital health apps. And all you need to do is put in your phone number, your email address, and the app goes straight to your mailbox or your phone. And that's it. Thank you.